Metabolic syndrome or syndrome X, global problem currently. Central obesity with waist circumference more than 95th centile, in man more than 94 centimeter, and in women or girls more than 80 centimeter. In any two of the following, the TG more than 150 milligram per DL, HDL less than 40 or less than 50 in 16 years old girl, hypertension more than 96 centile for systolic and diastolic, above 13 more than 120 by 80, fasting sugar more than 100 milligram per DL or on treatment diabetes, and history of cardiovascular disease and the family history of metabolic syndrome. And below 10 years, 6 to 10 years basically, when we have obesity, 95th to 98th centile, extreme obesity when it is more than 99th centile, and hypertension, you have dyslipidemia, you have more fasting sugar more than 100 milligram, you have family history of metabolic syndrome, diabetes, cardiovascular mishap, and dyslipidemia. This is called metabolic syndrome. The problem over here is the mechanism of damage in different organs over here. Always positive balance, excess food intake, and the insulin resistance develops in these people, and they have increased fatty acids and TG, triglycerides. They have decreased lipolysis, thereby they have excess fat deposition. They have hyperangiotensin 2 activity, and thereby more sympathetic activity, and they have leptin, ghrelin, obstatin, and adiponectin, appetite hormone dysregulation. So this obesity, hypertension, dyslipidemia, and your proteinuria, they have renal progression and ultimately renal damage, and a good amount of cases you have liver damage and cardiac impairment. You have CNS effect, multi-system disease. In renal damage, histology of the obesity and metabolic syndrome is increased glomerular size, glomerulomegaly. You have you may have segmental sclerosis, podocyte hypertrophy, focal food process effacement, and your podocytopenia ultimately. So approach of this case is multidisciplinary. Basic is the carbohydrate and the total calorie restriction, fat restriction, salt restriction, and sugar restriction, healthy lifestyle, exercise, and your healthy dietary approach to stop hypertension and others. So, and then a good opinion, dietitian is essential.